All right. And then once we get set, we're good. All right. Hey, thanks for doing this interview today, socially distant. So, of course, 167 cases today, leaving the county with over 1,000 active cases. So, taking a look at that, your general reaction to that news today?
Well, I am extremely concerned, have been for a number of days, as these numbers continue to stay above 100. And we know that those are only the cases that have actually been diagnosed. We believe that there's many, many people still out there who are undiagnosed because they're asymptomatic or have such mild symptoms they don't really know they have COVID. So it's imperative that everyone be extremely cautious in everything they do, because this virus is spreading and spreading rapidly throughout our community.
And then taking a look at that, Erie County, we had strong mitigation efforts from the get-go. Not saying we don't have strong mitigations currently, but taking all of the numbers into consideration, do you think we're losing control? How do the numbers today reflect how the community has COVID-19 under control?
We don't have it under control. I mean, that is a fact. Our health department staff has enough on their hands just to try to contact the person who's actually got the positive test. We cannot contact the contacts of that person. So that contact tracing effort that was so great and did, I think, so much in terms of mitigating the spread in Erie County is not happening right now. So we're depending upon the person who's positive to basically let their contacts know that they need to quarantine. So it's just very difficult to control this when you have these type of numbers exploding.
Are you fearful for the county's health?
I am fearful. We have 4 more deaths today. We know that yesterday there was 44 people in our hospitals here in Erie County. I'll have more numbers to report tomorrow. 2 people were on ventilators. There's also a very dwindling supply of that convalescent plasma. And I plead to the people of this community, if you've had COVID-19 or someone you know has had COVID-19, encourage them to go to our community blood bank and give blood, give their plasma, because they may be the person who saves someone's life. We know that convalescent plasma has been very successful in helping people recover from COVID-19. So that's something that those who've already had the disease can actually do for all of our community.
And then taking a look at our the mitigation efforts Erie County has, as well as statewide and across the nation, I guess, do you feel those are effective, or those kind of I guess expired now? Do we need to look at other measures to keep these numbers down or try to get them under control?
Well, we're seriously looking at other efforts here in Erie County, and I think it would be best if it was done across the Commonwealth. I saw Philadelphia put in some very strict mitigation efforts yesterday, as have other states across the nation. And we need to be looking at the Commonwealth as a whole, but we are looking at Erie County just as the county itself, and seeing what we can legally do and what really makes sense for us. We already have a masking order in place. It's been in place for a long time across the state. And actually, I have to say, Erie County does a really good job of masking up. And I hear this from people who go to other counties. They say it's so different in other counties than it is in Erie County. So thank you, Erie County residents, for doing that. But the other issues are gatherings, whether we're gathering for a baby shower or a wedding or an after funeral meal, or gathering together in people's homes to watch football on the weekend. Those are the kind of activities that are spreading this virus throughout Erie County. And so what we really need is everybody to voluntarily decide, I'm going to stay at home. I'm going to stay away from these gatherings. I am going to do what I need to do to help our community as a whole, because I don't know how we could ever enforce or put in a rule that would stop people from going to someone's home and watching football together. But that's what's happening. And so we really need people to take some extra precautions. Do it for the next month. Everyone just buckle down and say, I'm going to stay at home. I'm going to go minimally to what I need to do, whether it's work or a grocery store or whatever it is they need to do, but stay as close to home as you can.
You let in a couple of my questions there, Kathy. Just the first one is looking back at Philadelphia, kind of more of a red face of what we're seeing in there. When can the county step in and do that? I know you said you're looking into a couple of things, but how quickly could that happen?
Oh, it could happen quickly. We're going to be talking about that today. We're going to be talking about that later today. There is actually some health, community health law that would allow us to do that. But again, I would rather see it done on the Commonwealth level because we know Crawford County's got large numbers. We know that Warren County, who didn't have hardly any cases for a long time, now is seeing a rise. This is not something that just stops at our border. And what we'd like to see is a more comprehensive approach.
And that leads into my other one is who does have the authority to post these restrictions? Is it you for the county? Can the mayor post restrictions in the city? Just based off of what we're seeing in Philly, I'm just curious.
This would actually come under the health department and the department's board of health. And it would actually fall under a law that would be called the Local Health Administration Law of 1951, actually. So we're looking at that because I don't have an emergency order active right now. And that's why I was able to do something back in March as the county executive, but it would really be within that health, public health law.
Do you think another day of these numbers would initiate you to put it in that emergency order?
We're talking about it today. Okay. We're talking about it today because, again, I don't want to restrict people, but we also have to think about what is actually feasible to enforce, because that's the other piece of this. You could put things in place, but how do you enforce them? So does it make sense to do something that you can't even enforce?
And so you discussed that masking is going well, but I guess the social responsibilities within the community, is that kind of a failure right now on Erie County's behalf, or the individuals that are going, let's say, to rallies or a house party? We have Thanksgiving around the corner, and I anticipate we'll probably see a lot of gatherings that probably are against medical experts' advice.
I mean, that's what people are doing. So, if you go over to someone's house and there's people there from various different households and you gather there, even if you keep your mask on, which I would imagine many people do not keep their masks on once they're in someone's home. Even if you keep your mask on and you're together for over 15 minutes and someone in that room has COVID-19, the chances of you contracting it are there. So the risk is there. There is no non-risk social activity at this point. I mean, the best thing you could do, and this is what my family's going to do on Thanksgiving, we're going to go for a hike or a walk somewhere together outside. We're all going to wear our masks the whole time, and we're going to hike or take a stroll. We're going to do that and see each other that way. That's the safe thing to do. And then we're going to all go to our respective homes and we're going to have dinner. So we've got to all make sacrifices. This is one holiday season out of our lives, and we want to make sure that everybody we want around that holiday table can be there next year. And that's what people need to think about, or your neighbor's family can all be there next year. So it's really about social responsibility for this community as a whole. And we have to do this together collectively, or it doesn't work.
And then piggybacking off Ms. Withers' question, so what is that time frame looking like if we were to issue another order or a new mitigation effort? When could I know you're talking about it now, but when could we see that product implemented in Erie County?
If we are going to do something, we're going to do it soon. I mean, very soon, within a day or two.
And then I want to talk a little bit about contact tracing. So you mentioned earlier that they're struggling right now. Now it's falling to the responsibility of the positive case to notify individuals. So is Erie County looking to hire more contact tracers? Are we still in that process, or are we so far down that rabbit hole it's going to be mission impossible?
We have had numerous job postings up for our health department, all related to COVID-19 efforts. And I think we had 100+ applicants for those investigator contact tracer positions. So, but you have to realize, just because someone applies, they still have to go through the whole interview process, and we have to get them on board. And it doesn't just happen overnight, and people have to be trained, obviously. So we are looking at trying to either other county employees we could move into doing some of the work of the health department. We are looking at that currently. So we're looking at a lot of different things and trying to move as fast as we can. But we thought we had brought a lot of people on, and we're doing really well for a while, even when some numbers had had risen up earlier this fall. We had plenty of staff. Now we're really dependent on some state staff, but we know how COVID-19 is spreading across the Commonwealth. So everyone is overwhelmed.
About how many would you project that we need to get a hold of this, or ahead of this this issue?
Gosh, I don't even think we could hire enough people to get ahead of this issue right now. There's just that many cases. You think about this, we have 169 cases today. Let's just say each one of those people has 10 contacts. And that's probably a conservative estimate, considering what some people have been doing. That's a lot of people to call. And these calls are not just quick, one and done. You're on the phone with them for quite a long time because people have a lot of questions and there's a lot of details to go over. And that's unfortunately the thing we cannot do anymore.
Do you suspect, I don't want to make this a political issue, but do we think any of this, so we had the political season just ended, we had people at voting polls, we had people out, etc., doing X, Y, and Z. Of course, we had the people from the polls that who preside over those going back to the courthouse, and then we had the president's rally, Biden here. These people obviously congregating together. Do we think any of these clusters or outbreaks of COVID-19 are directly attached to any of those?
So, when the investigator calls the person, if they can make those calls, right? They're only asking about what did, they're talking about the last 48 hours. If they came, say you come down with symptoms today, they'd be talking about the last 48 hours. They wouldn't be looking, well, where were you in the last 14 days, which is when you can pick up the virus. So, I mean, personally, I don't have, this is just my assumption, is that some of the gathering that happened around the elections, not on one side of the aisle or the other, but all collectively, I'm sure there was some spreading of COVID-19 in all of that work that was done amongst the campaigns and all of the election effort that happened. I think we tried to be as careful as we could in terms of the county and how the county actually performed in terms of the polling sites and those type of places. But there was a lot of people coming together. We even saw people coming into the courthouse in numbers we hadn't seen since prior to COVID. So we tried again to keep everyone separated. But again, you just had a lot of people mixing together. So I'm sure there was some happened there. We know that there were some Halloween parties. We definitely know that there's some Halloween gatherings that happened. We know that people have decided to go out and do social things together. And that's where it's happening. We also know through sports, it's also been spreading. So there's just a multitude of ways that this is spreading. Even I heard of a woman who was in the hospital and she didn't know really what she had done. But one thing she had done is she'd gone to church. And people in that church, and I don't know what church it was, were not wearing masks. So even going to church is probably not a safe activity at this point because of all of the COVID-19 that is out there right now.
So if the community isn't going to police itself, obviously people breaking those self-isolating rules and doing different things, I know you said you're going to have conversations today, but what are some of the things that the county can do to stop this and try and protect the community here?
We can't do it without the people cooperating. We cannot. And then our hospital systems are going to be overwhelmed. I mean, right now they're holding their own, but you got to remember 44 cases is a lot. And I don't know what they'll be tomorrow, but I imagine they'll be higher. And so none of us want to see that happen, that our hospital systems are overloaded. You see that in El Paso, we've seen it in New York City, we've seen it in the Dakotas. I mean, we've seen the picture. It's not a good picture. It's not a place any of us want to be. Because think about that. If the hospitals are overwhelmed with COVID-19 patients and you all of a sudden have a heart attack or in a bad accident or a number of things that could happen, you want to make sure that they could take care of you for that issue. And they may be overloaded with COVID-19 patients and make it very difficult to treat you for what might have happened to you. So again, we need to think about the whole system, and we need to think about the fact that we can't do this without the cooperation of the citizens. It's just impossible.
Go ahead.
Oh, my last question for my part, if there's one thing you want to get out to the community, what is it? What do you want them to know?
I want them to know that they can be part of the solution here, that they can actually serve their fellow citizens well by staying home, by staying away from people. by basically having a personal stay at home Thanksgiving and days before and after. That's what we all need to do. And I can't say that enough.
My final one too is we know that the governor is going to speak today and along with secretary just about this. If they place any form of restrictions, will that initiate you to make some maybe even more than what they are going to place today and make that faster if they place anything this afternoon?
Well, I don't know if we will have to do anything further depending on what the state does. I just know we need to have further mitigation efforts to try to assist our health systems. I mean, that's really, I guess, the key here is right now is the health systems and obviously the individuals who are sick, but we've got to make sure that our health systems don't get overwhelmed. And that's what probably scares me the most.
All right, I think that's the end of our mini press conference today.
Hold on, let me just make sure I hit the record.